She currently practices and manages her multi-site clinics, Audiology Innovations Limited, in the Mission and Glenbrook areas of Calgary. She also sits on the board of directors with the Deaf and Hear Alberta non-profit organization in Calgary, and she studied at the university. So tonight, from what I understand, Dr. Scarf will cover the science behind hearing loss, the most common signs and symptoms, as well as the relationship between, I'd like a volunteer to read that for me.
Toxic medications. It's easy.
Oh, sure. I'll skip that. And hearing loss. Even with my glasses, the print's too fine. So with that, I'm going to turn it over to Dr. Scarf.
So I'm Carrie Scarf, audiologist, and I hold a PhD in auditory science. And I just wanted to thank you so much for so warmly welcoming me tonight. As soon as I came in from parking, one of your committee members, or past president, David, was right there to meet me and really made me feel at home, and I met Kelly and some of your board members as well. So thank you. It's lovely to be invited to share educational information with you about hearing loss and ototoxic medications. And we're going to get to what that means and why it pertains to probably some of you or some of your friends and loved ones in a few moments. All right, so here's my team. As you guys mentioned, I work at an audiology clinic. It's called Audiology Innovations, and I started that about 15 years ago now. I did a lot of research on the hearing system and the brain when I was doing my PhD, and I decided that I wanted to share this information with real people, real clients, to be able for them to get the best benefit from a clinic who was helping them with their hearing loss needs. So that's why I started my own clinic, because I wanted to share what's available in the research and the literature with everyday people who need help with their hearing. Because I really felt that there was a bit of a miscommunication or maybe a lack of understanding of the fact that hearing loss is not just related to the ear, but it's also related to the brain. So here's my team. I have a lovely team of professionals who work in hearing science, who work at both locations. And one of the important things to know for perhaps yourselves or your friends or your loved ones is that we actually offer mobile services as well. So for some individuals, particularly in the winter months, it might be hard for them to come to us. So we have the ability and the devices, technology, computers, and all of the assessment equipment to actually go out to them and provide services to them in their homes or in their senior care residences. So what do we do in audiology? What do we do at our clinics? We treat people who have permanent hearing loss. So if somebody has hearing loss due to a medication related to their cancer treatment, that in most cases becomes a permanent hearing loss. So that is the type of hearing loss that we work with. We don't work with people who might need a surgery or who have a hole in their eardrum or wax that's impacted in their ear canal. What we do instead is we help people who have permanent hearing loss by providing them with the devices and equipment they need to hear better in their whatever daily situation is important to them. So for example, if they come to a lecture like this and have trouble hearing in this situation, we would make recommendations for how they could hear better in this situation. So we have all sorts of different devices, but the point being, hearing is a very important part of our overall quality of life. So if you think about how we connect with people, one of the most important ways that we connect with people is through communication, speaking to people, and being able to hear what they have to say to you and back to you when you ask them a question, perhaps. Or listening to music. We get an awful lot of enjoyment from music or from environmental sounds if we go hiking and we want to hear the birds. So why do we do what we do? Because we want to make sure that you're connected to the sounds that you want to hear in your everyday life. So some of the learning objectives I thought we would try to achieve for today include just updating you guys on how common hearing loss is. It's probably much more common than you would think. So I'm going to show you just a little bit of recent Canadian data to update you on that, as well as some recent research that shows hearing loss can be related to ototoxic or disease-inducing medications, basically. So ear toxic medications. That's what ototoxicity means. Hearing loss can also be related to dementia, so we'll talk about that. We're all getting older, so that's a concern in the general public as we age. It can also be linked with diabetes. We'll talk briefly about that. And finally, I'll mention the link between cardiovascular disease and the risk of falls and hearing loss as well. So as you can see, hearing loss is just one component of our overall health, but it's linked with a number of other important medical concerns. And we'll just briefly cover the basic treatment options, including hearing aids and other devices, so that you have some skills and tools to ask the right questions if you need to go and get help with your hearing and you're starting to look down that road. So here's a picture of the tiny little hair cells deep within our ear. So there's a structure deep. These aren't the hair cells on top of our head or the ones that might stick out of our ear. These are the ones that are deep within our ear that we can't see. And these little hair cells are the receptive cells for picking up what we hear every day, whether we're awake, whether we're asleep. They're tiny, and we're only born with a finite number of them. Over our lifespan, they wear out with time. So you can kind of equate them to the tread on your tires. The more that you drive, the more that your tire tread wears out. Okay, so we have a certain number of hair cells over our lifespan. As we grow older, they start to wear down. But here's the other thing. They can get worn down or damaged by other factors, including being exposed to a lot of noise. Okay, so the noise overuses them, or being exposed to certain types of medication. So ototoxic medications. So medications that are poisonous to the ear. So those are very important receptor cells that basically are related to probably 90% of the hearing loss that we see in Canadians as we age. So here's the statistics that I wanted to share with you. It shows the incidence of hearing loss in Canada, and this comes from some pretty recent research. We didn't have research before this was done in 2012 and 2013. It was completed by the Canadian Health Measures Study. And they were looking at all different types of medical concerns and medical issues with people as we age. One of the things that they tested was hearing loss. What they found was that in patients over age 18, so anywhere over age 19 up to age 79, almost 20% of Canadians had at least a mild hearing loss in one ear. 20%. So that was much higher than we anticipated. What was even more surprising, perhaps, was that almost half of Canadians between the age of 60 and 79 years old had a hearing loss, a mild hearing loss in at least one ear. They didn't even test Canadians over age 79, but of course we would anticipate the rate would be even higher. So over age 60, approximately half of people have at least some hearing loss in one ear. And by the way, it was enough hearing loss. The test that they did would actually affect your ability to hear speech. Okay, that was kind of the criteria. So it's certain tones, you had to have difficulty hearing 4 specific tones of sound. And if you failed the test, that would mean you probably would have some difficulty understanding what you hear when people talk to you at an average speaking level. So much higher than we anticipated. Why is this important? It's important for a lot of reasons, but one thing that's really important is that about 70% of the people who were identified with hearing loss from a test, it's an objective measure, it's a test, about 70% of them had no idea that they had hearing loss. So I was talking with some of your board members when I first got here this evening, and I just mentioned that, you know, when it comes to ototoxicity, so damage to the ear from cancer medications, for example, the effects can linger for a long period of time, and they're generally gradual. And what's important to know is that the person who has the hearing loss may not realize that they're going through these gradual changes of hearing. So it's very important that we as spouses or support people or friends or family point this out to the people that are around us, because most people don't realize when they have some hearing loss. And then the other reason why it's important that we know how much hearing loss there is in different age groups is because we also know that the Canadian population is aging significantly. So in 2016, it was the very first time in our census that we found people aged 65 and older were a larger group than people under the age 14. So we have a big bubble of people aging throughout the generations, which means we're going to see more and more people with hearing loss. And yes, most of those people don't recognize that they have hearing loss. And there are some important implications for that, for their quality of life. So again, why is it important that we consider, physicians, for example, consider screening people for testing? Because people aren't aware of their hearing loss. People also tend to wait to do anything about their hearing loss. And because there are relationships to other health concerns, dementia, cardiovascular disease, diabetes, depression, and risk of falls. So ototoxic, what does that mean? It's any medication that damages the ear. It's called ototoxic. Oto means ear, toxic obviously means toxic and can do damage. It can result in hearing loss that can be temporary in some cases, but also can be permanent in other cases. It can result in tinnitus, which is a phenomenon where you hear ringing or buzzing in your ears for no apparent reason. And it can also result in vestibular issues too. So some of the temporary reasons for ototoxicity, or this damage to the ears, can be things like salicylates. Okay, so you might get, if you take a high dose of aspirin, you might get a little bit of ringing in your ears. That's a temporary type of effect. Non-steroidal anti-inflammatory drugs, so the type of analgesic medication that reduces pain or fever or inflammation. Things like aspirin, Bufferin, ibuprofen, naproxen, etc. So those types of things can induce either ringing in the ears or some temporary hearing loss. But in most of those cases, if we reduce the use or if we discontinue the use, then the hearing actually improves. It's one of the only cases in science where hearing loss is actually temporary. Now, there's another type of, there's antibiotics, certain type of antibiotics that are used for bacterial infections. And in most cases, those can cause a temporary hearing loss, but in a very small percentage of cases, those can cause a permanent hearing loss as well. So those are things like gentamicin, tobramycin, streptomycin, and amikamycin as well. Now here are the ones that are really important in your world of cancer treatment. We know that cisplatin, so in about 50% of adults who are treated with cisplatin, and anywhere from 40 to 80%, the report shows, of children who are on any kind of platinum-based chemo, such as cisplatin, have a permanent induced hearing loss. And that, of course, as you're probably familiar with, is one of the most common chemotherapy agents delivered intravenously. So it's one of the most common treatments that we see with cancer, and many different types of cancer. But what's important for us to know is, why does it cause hearing loss? The most recent research shows that the body can eliminate the cisplatin in most other organs and other parts of itself. But for some reason, the cisplatin stays in the inner ear and it accumulates over time. It just gets stuck there. So what's happening is, and this is also why we think that there can be hearing loss later following the completion of treatment. So what researchers are working on right now is trying to find a way to reduce how much the inner ear absorbs of the cisplatin. So that's where the research is right now. It's in a very specific area of the inner ear called the stria vascularis. So what are some of the symptoms to look for if you or a loved one or a friend or family member has had this type of treatment? Tinnitus is one of the first indicators that something might be happening. So again, just to clarify what tinnitus is, it's ringing or buzzing or humming in the ears when there's no external sound present. Okay, so everyone has it from time to time. If you sit in a really quiet room or if you lay in your bed and think about nothing and try to hear it, you probably will. Most people will hear that from time to time. But if you're getting this, if this is a new occurrence and it's occurring more frequently, then it might be time to get your hearing evaluated. Hearing loss, another symptom, can be mild to profound, okay, following the treatment, and it can occur after long periods of time. And I didn't find any current research to show how long that extended period of time is, but I would definitely say it makes sense to monitor anywhere from 5 to 10 years after the completion of treatment. And it certainly, the hearing loss will depend on how much damage is done in the inner ear to those little cells that I showed you the picture of, those little tiny hair cells. That's what's happening. They're getting damaged from the medication. So monitoring is very important, not only perhaps of your friends and family, but once you notice some hearing loss yourself, to get a baseline test is an excellent idea, and then your audiologist can monitor you every few years. Here's the other reason why it's so important that we identify hearing loss sooner rather than later, is that we've known this information that hearing loss is related to the brain for probably decades. But what we have evidence of now since 2017 is that untreated hearing loss is one of the highest risk factors for dementia. It's one of the top 10 risk factors for dementia, and it's a treatable risk factor, which means we can take away that risk factor and reduce your chances for dementia. So it's modifiable. So my question always is, if we can modify it, why wouldn't we? But we'll talk about reasons why people don't receive treatment for their hearing loss in a few more moments. But what I liked about this study, so this was actually a study to do with dementia, not really to do with hearing loss. It was about aging, about different factors that can relate to risk factors for dementia, different kinds of rehabilitation options for people who have dementia. And they looked at studies that were done. It was a comprehensive study. They looked at studies that were done at different universities throughout the world. And what they really shared was that, yes, hearing loss is potentially modifiable, and technology could be part of that solution, as it can be for other risk factors for dementia, like social isolation, for example. But we have to remember that technology is only technology. It's only one part of the equation, and social interaction is very, very important as well. And I love that because, whenever I start talking about hearing loss and then start talking about hearing aids, we have to remember that's only one piece of the puzzle. That's the technology. There's education, there's information, there's communication that goes beyond that and it is more important than the actual piece of technology. So why do we think there is a link between untreated hearing loss and changes to our brain, to our cognitive skills? And so when I say untreated hearing loss, that's someone who has hearing loss who hasn't done anything about it. They might be walking around for 10 years and they have hearing loss, but they don't have hearing aids, they don't have any kind of assistive device. They just walk around with their hearing loss as is. Okay, so why do we think there's this link? So in 2014, Dr. Frank Lin from Johns Hopkins Medical Center published some results. And basically what he did was he looked at the functional MRIs, so the activity in the brain of people who had hearing loss for at least 4.5 years or more. And what he found was that the gray matter in the brain of the people who had hearing loss for 4.5 years or more was different. It was significantly different. There was atrophy. There was actual cortical shrinking of the cells simply because there's not enough activation at the ears. The ears can't pick up the sound and send it up to the brain. So that was the first time that we had evidence that, if the receptor, let's call the ear the receptor for the moment, if the ear receptor isn't picking up the information, of course it makes sense. It can't send the sound up to the brain and keep the brain cells properly stimulated. So this was not too surprising. It was excellent evidence for us to show the importance of keeping the brain stimulated with sound. But what was surprising was that other areas of the brain were also affected. The areas that are responsible for memory, executive function, vocabulary. So that was the surprising part. Essentially, the brain gets a lot of information from the sounds that we pick up in our environment. And if it's not getting the accurate information, then it can't necessarily make the accurate memories, or it doesn't have practice with vocabulary or making plans, for example. So that's what we expect is the reason why there's this relationship between walking around as a person who has hearing loss and not doing anything about it and seeing effects on the brain. There's one other reason for it as well. And this goes back to social interaction. So one of the reasons why I love doing this kind of work where I share information with groups is because it's very rewarding to see people take the time, like David and your board members, to interact together socially, help each other, volunteer, share education and information. And it's not just rewarding because I think it's great and it's positive, but it's excellent for the brain. So social interaction, there's something very special about communication, about humans interacting with each other. And if we take that away, if you stop being involved in these kinds of activities, that actually has been shown to have a negative impact on your brain health. So what we believe happens with people who have hearing loss, in many cases, they stop taking part in their favorite activities because they don't have the same level of confidence. They often will mistake one word for another, or they might react inappropriately when someone asks something. So they lose that ability to feel confident in these social situations, and they often will withdraw and stop being part of them. So that's the other reason why we think that having untreated hearing loss is very negative for the brain and brain health. So some other relationships between hearing loss and other medical concerns. One is between cardiovascular disease and hearing loss. For this one, what we're talking about is people who have different types of cardiovascular challenges or insults, like a heart attack, for example. People with cardiovascular disease have about a 54% chance more likely to have hearing loss. Just for example, people who've had at least a heart attack were 80% more likely to have some damage to the inner ear and corresponding hearing loss. And again, it's not magic, it's the fact that we don't have, when we have any kind of cardiovascular insults, we don't have the same blood flow and oxygen flow to the inner ear. So what was really interesting about these studies when we looked at them in general was that people who exercise could actually reduce their risk of hearing loss. So when I do lectures to different groups of people, one of the most common questions I get is if there's any kind of vitamin or any kind of food that people can ingest to help keep their hearing healthy. There's no evidence for any vitamins or food currently. However, there's certainly evidence that staying healthy, having a healthy cardiovascular system is good for your hearing. Hearing loss and the risk of fall. So the same professor from Johns Hopkins Medical Center has looked at a number of different medical concerns related with hearing loss. And he found that people who have even a mild hearing loss were at a triple risk for falling. And this was in a group of over 2,000 people. The more hearing loss they had, the risk was increased substantially. And the other thing that was interesting was in a test that was done by another group, people who have hearing aids who put them in their ear and turned them on did better on balance tests. So it all has to do with being aware of the sounds around us, okay? So we use our eyes, we use our vestibular system to try to position ourselves in space, but we also use our ears to give us cues as to where we're standing in space and how we're moving through space, our footsteps and how far we are away from the stairs, for example. So having untreated hearing loss is also related to having a higher risk of falls. The relationship between diabetes and hearing loss is also a very strong one. Hearing loss is twice as common in people who have diabetes. So it's really important that physicians send their patients for hearing testing if their patients have diabetes. Now, the strongest relationship, surprisingly, was not in the older group of people that they looked at. It was in the younger group, with the fact that the small blood vessels and nerves in the inner ear are affected by the changes to glucose levels. And those glucose levels can damage the tiny little vessels in the inner ear. So it's really, really common. When I was talking to Kelly earlier this evening, she said she had no idea that cancer treatment medications could affect hearing loss. The same thing goes with diabetes. Even many physicians have no idea that their diabetic patients are at a higher risk of hearing loss. So it's just a question of getting the information out there, sharing that with health professionals and the general public. Hearing loss and depression. There's definitely also a link between people who have hearing loss and depression. The average rate for individuals who have hearing loss in the general population is about 5%, and it's suggested to be about 11%, so more than double in people who have hearing loss. And one really interesting point in some of the studies I read was that the inability to hear and understand when there's noise around causes people to have a sense of loneliness. So they can feel, they can be in a large group, but they can still feel isolated in it. So that's something that is really important to understand. And you may have seen this with some of your friends or family or maybe yourself. If you go somewhere like a noisy restaurant, you start by trying to follow a conversation in noise. It gets tiring, so you take breaks, and by the end, sometimes you're just completely withdrawn from that conversation, right? So that it's really important to know, if that's happening to you regularly in your environments, you should probably have that assessed and see if there's something that can be done. Once we improve hearing loss, I see this all the time. I see improved relationships between spouses, between patients and their children, patients and their parents, patients, all different groups of patients. Once someone has that confidence again to interact and feel comfortable, they often get active in the situations that they enjoy, and that boosts their confidence. It also, what we have to remember, we just did some training a few weeks ago, and we have to remember someone who has hearing loss isn't the only person affected by that hearing loss. It's also the sphere of people around them. So whether it's their spouse who has to keep repeating what they've said, or whether it's their, grandchildren who have to, where there's some miscommunications happening. So the relationship between the person with hearing loss and the people around them can't be forgotten. We have to remember that that's really, really important. And in many cases, I will tell you, it's often the support person, whether it's a spouse or daughter or friend, who suggests that the person with hearing loss actually come in to see me. It's very, very common. And again, remember, patients do not necessarily know that they have hearing loss because it's often gradual, so they don't realize the sounds that they're missing gradually, nor do they often seek treatment. About 3/4 of people who, once they are identified with hearing loss, about 3/4 of them do nothing. So they might identify themselves with, get a test done, realize, okay, I have hearing loss, and then that's all they do. They don't search for any improvement or any rehabilitation. If they do decide to do something, it generally takes about 7 to 10 years for them to do something. And so why is this a problem? Remember that study from Johns Hopkins? We see changes to the brain after 4.5 years. So this is important to know. There's other changes besides the brain, though. There's also, I had some lovely patients today, and they said, we are here because we don't want to do what our parents did, which was wait until they were elderly, 85, to get help with their hearing. If we wait that long, imagine the changes to our visual system and the changes to our manual dexterity, trying to deal with tiny little hearing devices and change batteries and put them in our ears and remember where we put them. So, there's other changes that happen as well. So it's important to identify if there is a concern and receive treatment sooner rather than later. What are some of the impacts of untreated hearing loss besides the medical ones that we've talked about? So a lot of people, especially working people, will tell me they are exhausted after a full day of trying to compensate for their hearing loss. So, for example, they work all day and then they get home and they just are so tired. And you can imagine if the brain is trying to compensate for the hearing loss, it has to use a lot of extra energy for that, and it can't use that energy for other things. Like I mentioned, social isolation, so people start to withdraw from the activities that they used to do, depression, miscommunications, and insecurity. Those are some of the impacts of untreated hearing loss. Now here's some new research that came out, relatively new, in 2015, that showed us for the first time that if we improve a hearing loss, we can see some improvements to the cognitive abilities. It was a study done in France. They looked at almost 4,000 people over age 65. And what they looked at was, if we provide treatment to someone who has hearing loss, will they have better cognitive abilities? Things like remembering where they put something, or abilities to recognize words and vocabulary, or plan different functions. And what they found was, yes, in fact, in the group of people who chose to improve their hearing versus the people who did not, the ones who wore hearing devices over 25 years had better cognitive abilities. And this was shown, again, in vocabulary, executive function, and memory. So it's the first time that we were able to suggest that hearing aids provide somewhat of a protective measure for keeping up our cognitive skills. And there's also some other prospective studies underway in Europe, in Japan, and other countries as well. But this was the first conclusive study that showed us, we knew that if we have hearing loss, we can have changes to the brain, but now we can say, if we have hearing loss and we do something about it, we can keep the brain properly stimulated and healthy. Now, here's something really interesting. I was talking to Kelly a little bit about noise. And what's important to understand is those little tiny hair cells in our inner ear, again, we have a finite number of them. So if we're exposed to loud noise, basically what we're doing is prematurely aging those hair cells. Okay, we're wearing them out sooner than they would naturally wear out. So if you do any kind of loud, noisy activities, and everyone does different types of activities, it's really important that we protect our ears with ear hearing protection. And here's just a little rule of thumb for listening to safe sound. If somebody is an arm's distance away from you, okay, here's two things. If they're listening to their music from their iPod or any kind of device, you should not be able to hear that music. Okay, so if this is your spouse or your kid or your grandkid, that's kind of a rule of thumb. The other thing is, if they're listening to their music and they're about an arm's distance away, they should be able to hear you if you say their name. Okay, then you know that the sound is at a reasonably safe level. And technology is helpful for measuring things like sound levels. You can download an app very quickly on your phone and measure what the sound level is of the cars that you're driving, for example. And, it's really, really important that we consider the fact that sound can be dangerous, because years, decades ago we didn't. We're becoming more aware of it, but we still forget that things like a hair dryer or things like a Dyson vacuum cleaner, they're loud enough that if they're close to your ear for a long enough period of time, they're going to wear down those hair cells. Okay, so very, very important to just kind of remember that loud sounds can be dangerous. And then hearing aids. One thing that's really important to understand when it comes to hearing loss, where the hair cells wear down, we can't regrow those hair cells. They're working on that in the United States currently at the University of Kansas, Columbia University, and Johns Hopkins Medical Center. However, what's important to know is even if we regrew those hair cells, even if we could regrow them perfectly in the perfect patterns that they're designed in when we first are born, would the brain be able to recognize the sounds from those hair cells that are being sent to us? Not if we've left our hearing loss for a long period of time. So even if the research moves forward to a point where we can regrow or re-stimulate or replace hair cells in our inner ear, it's still very important that we keep our auditory system properly stimulated. So what I mean by that is if someone has a hearing loss now, they should really receive treatment sooner rather than later to keep the auditory system, the cells at the brain, working, so that they potentially could receive an implant down the road. What we do right now, instead of regrowing hair cells, because we're not there yet, is we use hearing aids. And what hearing aids are is computers. And I think that's really important for people to understand. There's often the thought, hearing aids are very expensive. Why are they expensive? There's two main reasons. Number one is that they're computers. So, when you're wearing a hearing aid and it's sitting on your ear, you have one of the fastest, smallest pieces of technology available anywhere in the world. And they are modifiable. So as your hearing loss, and one of the ladies is showing one over there, as your hearing loss changes, because they're computers, we can modify them to work for your changing hearing loss. So that's really important to understand as well. When your eyesight changes, you have to get new lenses, you have to get new glasses. But with hearing aids, that's not the case. We can adjust them for your changing hearing loss. So that's really important to understand. The other thing to understand is the device itself is a piece of technology. It's a piece of plastic, there's electronics in it, but there's algorithms built in there so that the hearing aid will do specific things when you're in specific places. And that comes down to research and technology. So it's not just that we would be turning up sounds equally. A lot of people are under the impression that if we put hearing aids on them, it would be turning up all of the sounds equally. That's not the case at all. So the sounds are turned up very specifically based on your hearing loss profile, which is probably different, slightly different from one ear to the other. They also would enhance certain voices much more than other voices, depending again on your hearing loss profile. So, they're really advanced computers, which is great, but the most important part of hearing aids is working with somebody or a team of people who can teach you how to use them, adjust them thoroughly, and make sure that you're successful with them. That's important too, as important as the piece of technology in your hand. So what are some of the updates with hearing aids? Open ear styles that don't block your ear, are some of the more recent types. The Lyric, the one on the top there, it's a non-surgically implantable type of hearing aid. So some people, for example, who don't want to fuss with putting a hearing aid on in the morning and taking it out at night, or changing the battery or recharging the battery, we can actually implant these devices right next to their eardrum, and they stay in there for about 2 to 3 months at a time, and then we replace them. So that's something that's relatively new. Rechargeable devices, finally, are reliable enough that I would recommend them. So they're great, especially for people who have maybe reduced manual dexterity and trouble changing a tiny little battery that's smaller than my fingernail. So we would just, they take their hearing aids off their ear and plop it into their recharging case at night, just like your phone. Special systems for people who have one deaf ear. People don't realize that there are special devices for that as well. So if I had a deaf ear on my right side, I would wear a little device that picks up sound and sends it to my other ear so that I can get information from both sides. So that if I'm at a restaurant, I can still hear both of my partners sitting next to me. Bluetooth devices, so there are some hearing aids now where I could be wearing my hearing aid right now, someone would phone me, I press the button, and I hear people talking through my hearing aid, and they hear me talking through my hearing aid. Water resistant, so people in Calgary are very active and they travel a lot, so water resistant hearing aids are a big benefit. We can, with most of the hearing aids now, we can drop them into a swimming pool for about 2 hours and they won't be permanently damaged. So that's really improved over the last little while as well. And then lastly, other devices that can work with hearing aids. So hearing aids are only one part of the picture. If somebody has hearing loss, we have to figure out what their hearing challenges are. We can look at different hearing aids that might help them. But let's say that when you come to a meeting like this, you have a lot of trouble hearing from a distance. There are other devices that work with hearing aids. So you see that little round circular device. That's a great one for restaurants, for example. If you're having trouble in background noise, you put it on the table. It picks up the voice that's talking automatically, and it sends it to your hearing aids. And that really helps in a noisy situation. So there are some additional technological advances that work in concert with hearing aids, but they work very, very well. You have to understand that hearing aids can only make adjustments to the sound that arrives at our ears. Okay, so if we're in a restaurant, the sound arriving at our ears includes people talking and noise. Whereas a device such as the round little device, okay, it's a microphone, a very powerful microphone that's put on the table. It picks up the voices that are closest to it, so it's like having an extra ear. It picks up the voices and sends the voices to our ears. So that really helps improve something called the signal to noise ratio, the ability to hear what we want to hear and ignore what we don't want to hear. But it's also important to understand that we have to have realistic expectations if we're talking about hearing aids to treat a certain hearing loss. They certainly make the sounds louder at the ear, but they can't deliver the sounds from a distance. They can't cut through the noise like some of the other devices would do. Beyond that, our brain has to interpret the sounds that we hear. So if the auditory cells have been shut down or atrophied, then of course we can't understand the message as well as we used to. And it's really interesting. After about age 35, our brain changes at the ability to do things like filter out background noise or follow rapid speech. If you ever hear people talking quickly on the phone, for example, and find that's hard, that's because our brain doesn't follow rapid speech as well. Remembering what we hear and just discriminating the accuracy between the little bits of sounds. So if somebody receives treatment for their hearing loss with hearing aids, consistency is absolutely the key. Okay, so just in the same way that learning a language requires immersion in the sound to really feel like you truly understand the language and all its nuances, being immersed in the sounds that you're hearing through the hearing aids or whatever hearing device you're using is really important. And this takes time for your brain to adapt. If you've had hearing loss for 4 years or 10 years or 24 years, and all of a sudden we're introducing new sounds that are produced by a computer and they sound different and we can't necessarily remember exactly what they sounded like 24 years ago, it takes time. It takes time for your brain to acclimatize to what these sounds mean and to feel and perceive like they're normal and natural. So if you have someone that you know who has been challenged with their hearing aids and have them in a drawer, or say they don't work or doesn't want to wear them, ask them this question. Have they been tested in the last 2 years? And have they worn their hearing aids consistently for 3 months at a time? They'll probably say no to one of those questions. So really important that we're walking around with the correct prescription in our hearing aids, just in the same way that we need to walk around with the correct prescription in our eyeglasses. Okay, so if someone has hearing aids and they've had them for a long while and haven't been checked up, then that's the first thing they should do. And then the second thing is they really need to be consistent with them. So be encouraging as a support person to say, you know, why don't you go get those checked again? Or why don't you take them out and start wearing them again? So just a few related ear issues to touch on again, because this one is really important when we're talking about ototoxic medications like cisplatin. Tinnitus, or ringing in the ears, like I mentioned before, is common. 92% of people identify it from time to time, okay? Unfortunately, a percentage of the population has tinnitus constantly. It can impede their daily activities. It can certainly impede their ability to sleep. So one of the successful treatments for tinnitus is, if you have hearing loss, is to improve the hearing with hearing aids. And in about 80 to 90% of patients who do this, their perception of the tinnitus reduces, so they don't notice the tinnitus as much. There's other behavioral components too. We know that stress is highly linked with tinnitus. So if you already have some ringing in your ears and you're under a great deal of stress, let's say you get a diagnosis of cancer, for example, people will often perceive their tinnitus as much louder or more prevalent. So behavioral management techniques like stress reduction, also managing things like caffeine intake and salt intake, and being well hydrated, those things can help reduce the perception of tinnitus. So I'll just close by saying that we'd be happy to see any or all of you if you do want to have a thorough evaluation of your hearing. One of you asked me, what's the difference between a test? Are all the tests the same? No, they're not all the same. One of the most important components of a test, in my view, is not only to test how well you hear different types of sounds, but to also test how well you can listen in background noise. Because I mentioned earlier, one of the most prevalent symptoms of hearing loss is having challenges hearing in background noise. So if we're not doing that test, then how can we assess your hearing abilities fully? So that is one of the things that we include in our thorough evaluations. And like I mentioned, we also do offer mobile services. And our patients are very, very successful. So if, I had a couple come in yesterday, and they had just the earliest signs of hearing loss, and they were so happy to come in and actually take the time to have the evaluation, because they learned about hearing protection, to protect the hearing that they do have. They learned some tips and techniques to keep their auditory system properly stimulated as they age. So we talked about things like listening to music. It's actually healthy for the auditory system at a comfortable level, not at a loud level. Listening to podcasts and things like that. And then we talked about the fact that they were showing the early signs of hearing loss, and that they should be monitored in about 2 years, because if they do fall outside of the normal threshold at that time, then we could look at some different rehabilitation strategies. It might include hearing aids, it might include some listening and noise tasks that we would give them. So those are some of the things that we like to share with you. And I'll just close by saying that if you have any questions, I see this as a forum for opening conversation. If you have questions of an educational concern about ototoxicity, about anything to do with your own hearing or the hearing of a loved one or spouse, I do have cards, and you can email me directly. I'm happy to help you that way. We do send out an educational newsletter. It's only quarterly, And it's everything to do with the updated research. So different types of information that you heard about tonight. I like to share bits of information there. So if that's something that you're interested in, I can jot down your email address and add you to that. And then finally, I have some handouts about ototoxic medications and hearing loss and dementia, just information about, a little bit more information about our clinic, and some brochures and things. Great. Thank you very much.
No questions? Oh, I knew it. I knew it, there would be questions.
Yeah, just, is the testing or the evaluation covered by Alberta Health?
No. So Alberta Health Services has an audiology clinic.
Excuse me?
Yes.
I did not hear this.
Okay, good. Thank you. The question is, does Alberta Health Services cover the hearing evaluation? So it's a yes and no answer. No, they don't cover the evaluation at a private clinic, but they do cover it if you're referred through your physician to their audiology clinic. The challenge is that it takes about 9 months to get there. So, and they don't, I also know for a fact, because I used to work there, they don't do listening and noise testing, which is an important part of the overall understanding of your hearing. Our evaluations are $65 for the evaluation, and then we write up a report that we share with you and your family doctor if you like, at your discretion. And the reason why we like to do that is, again, because hearing loss can overlap with other medical conditions. Yeah. Thank you. Yes.
I've come through chemo, and one of the things that I noticed with that is I was losing all my eyelashes. They were catching in my eye, and I didn't realize it took some time off. But would that affect the hairs in the ear?
So the question is, after chemo, he noticed that he was losing his eyelashes, for example, and he's wondering if this would affect the hair cells in the inner ear. So no, they're called hair cells, but they're different types of receptor cells. So no, that's not the reason for hearing loss related to cancer. The reason is the medicine, basically, the cisplatin gets stuck in the inner ear, in the stria vascularis, and it blocks some of the activity, and it can damage the hair cells deep within the inner ear. But that's an enclosed compartment. It's very different than hair cells on our body, yes. But good question. Yes?
If you have like I have a problem of wax buildup quite readily within the ear, and if you have the implants or something like that within the ear, how does that kind of work in conjunction with each other?
Okay, so the question is, if you have wax buildup, so cerumen is just natural wax buildup in our ear canal. It helps protect our ear. And can you have those non-surgically implanted hearing aids? Yes, you can. It depends on how much cerumen you have built up, but I wouldn't say it's just because you have wax in your ears doesn't mean you can't have the implants. We'd have to assess that, and then we can remove the wax. And what happens, it's really interesting. I've had other patients who really wanted that type of device, and they had a lot of wax in their ears. Once we removed the wax and once we implanted the device, they didn't produce quite as much wax as they did before after a couple months. Yeah. There's a question over here in yellow.
Someone who's been prescribed hearing aids but doesn't wear them on a consistent basis, are they doing themselves more harm than good?
So the question is, if you've been recommended to have hearing aids and you don't wear them consistently, are you doing yourself more harm than good? You're not doing yourself harm, but you're making it harder for your auditory system. So if you put your hearing aids on when you go to a noisy restaurant because you think that's where you have the most difficulty hearing, okay, so you only put them on for that situation, it's actually very confusing to your auditory system, to the listening centers of your brain, because it's not used to hearing general sounds, much less noisy, busy, crowded type sounds. So you're not doing yourself any good, and you're making it much more challenging for yourself. If you already have them, my advice is it's very important to, try to get back on track, try to wear them consistently, okay? And that's one of the things we do, because we do a lot of outreach and education to the community. People will often say, well, I've got them, but I don't use them. So we will see patients, we will bring you in, we'll do an assessment, we'll see if we can help make what you already have work better for you. Okay? Yes?
The only thing is that she's obviously talking about me.
I'm talking about
Okay.
not myself.
But my hearing aids were given to me because of high frequency.
Mm-hmm.
And consequently, I wear them. One of the problems is that if a person speaking to me, like yourself,
Mm-hmm.
I can hear perfectly. If the crowd here started to talk together, that's when I have the problem,
Okay.
right?
Yeah.
So most cases I don't wear them. For one thing, I work with mechanical equipment, which drives me crazy about wearing them.
Mm-hmm.
So I don't wear them for that reason. But I also had vertigo, and I had a problem, I still have a problem with balance.
Mm-hmm.
I
Okay.
don't find that the hearing aids, correct that balance. But it does help in noisy places like restaurants and stuff. So I will wear them then.
Okay. So I think the point is that it's hard when you're in certain situations. You don't really feel you need the hearing devices, and you feel like there's a lot of noise in noisy places when you're wearing them. But here's the story. If you only wear the hearing aids in a noisy place, your brain never has the chance to adapt to the surrounding regular sounds of life, okay? Things like your heartbeat or airflow or your footsteps or your wife talking. It has to... Your auditory system has to get used to the normal sounds first, and then it learns how to filter out the other more challenging sounds. Think about running a marathon. You wouldn't just expect to wake up tomorrow and run a marathon. Okay, you would have to start by, training for a 5K, maybe walk, and then maybe a run, and then a 10K run, and a half marathon, and a marathon. We have to get all the blood flow and all the muscles working. It's similar in that way. We have to get the auditory system working. Your brain has to start recognizing the sounds that you haven't heard for a while gradually. So you need to wear them consistently to feel like they help you in more situations. Okay.
That's why truthful, I've been told that before.
You've been told that before. Good. Okay. Well, I'm telling you again. Yes, question.
I wear hearing aids and they're wonderful. And I have a good doctor who helps. Dr. Syed, you may know him. And but I just lost one.
Okay.
And I haven't replaced it because of the cost. I'm probably doing some harm, aren't I, by not replacing it in one ear and just...
So the question is, if we only have a hearing aid in one ear and we have hearing loss in both ears, what's the status? There's research to show, it's called auditory deprivation. If we have hearing loss in both ears and we're getting sound to one ear, the connections to the other ear get lazy. Yes, that's what the research shows, and that's been shown for several decades. Yes.
How long do I have before? It's a budgeting thing, because
Yes,
it costs a lot of money.
I understand that. I mean, at our clinic, we have loaners for people where things, if you were talking about 6 months or something, that's might be a possibility until you can replace it. Yeah, so that's what we do.
Because the government helps every 5 years.
Correct, the government
And
helps.
that's about 2 years away.
Oh, I see, yes.
I just wanted your opinion.
I wouldn't, so my own opinion is I wouldn't leave it for more than a year. That's my opinion. Yeah. Yes.
Yeah, I'm quite impressed with, and I wasn't aware of this before, the implantable hearing aid because my good mother-in-law, bless her soul, she would lose her hearing aids every 2 months, 3 months, 4 months, or whatever. So I'm curious about the implantable. What's limiting its use to 2 months as opposed to?
So the question is about the implantable hearing device. What limits the use is the battery life. So basically, we replace the actual device after the battery stops working. That's what limits it. But I have some patients who wear it for 3.5 months.
And then can be recycled? Is the battery replaced?
No, it's replaced. The entire device is replaced. Yes. I've used it with people who have dementia. It works very well for them because they can't necessarily, they've maybe lost multiple hearing aids. We've used it with people who have young infants and they need to hear at night because, of course, with the other type of devices, you don't wear them at night. And I've also used it with people who have tinnitus, really severe tinnitus at night. When they're wearing the devices, they can hear extraneous sounds, and that helps reduce how much they notice the tinnitus. Yeah.
Thank you.
Mm-hmm.
Just mentioning white sound, something Mike mentioned tinnitus.
Tinnitus. Mm-hmm.
I suffered from that because I was on the footplate of an engine that had a huge whistle and it damaged my ear.
Mm-hmm.
But I have, one of the programs I have is like white sound.
Right.
White noise, white sound.
Mm-hmm. So
I can choose to put that on early in the morning when it's the worst.
That's right.
And
So
during
after,
the day, I don't notice the ringing.
right.
And it's a wonderful program to have.
So what happens with tinnitus is after we've been sleeping and we haven't had exposure to a lot of noise and then we wake up in the morning, that's because there's not a lot of activity. Often we'll notice the tinnitus or tinnitus louder at that time. And yes, so what this gentleman is mentioning is that a lot of hearing devices have special settings where you can either have white noise or even musical tones or different kind of relaxation settings. And the purpose is to just distract your brain from the sounds that it's creating on its own in the brain. The source of the tinnitus is actually the brain. It's not the ear. When the ear has a deficit and can't send all the messages up to the brain tries to keep those cells alive and they spontaneously fire and they create what's known as tinnitus. People perceive it as ringing or humming or buzzing or music, even in some people. But it's the brain's way of trying to keep those cells active. Yeah, so the opposite is true. We try to keep those cells active with real sounds. And that's what we do by wearing hearing aids or using a masking. That's what you're doing, using a masking sound. Yes.
Good. One last question, Kurt?
Thank you. If you do have wax build up in the ears, what's the best way of looking after it?
So if you have wax buildup in the ears, what's the best way to look after it was the question. If you have healthy ears, you can take care of it yourself. So you can use a mixture of hydrogen peroxide and lukewarm water, 50-50. Put a couple drops in your ear, keep your ear up for a few minutes, and then you can go into the shower and let some warm water get in there. Use a little Kleenex around your pinky finger and try to just clean out anything that comes out. If you've had a history of ear infections or a hole in your eardrum, we wouldn't want you to do that. So it's recommended, first if you have a hearing evaluation and then your audiologist says, yes, you can do your own home care routine of your wax. We actually have a handout. If you're interested, you can email me. I can send you the handout on how to do that. Yeah.
Thank you.
Great. You're welcome.
Great. Well, thanks so much, Carrie. That was, again, another learning moment. So I know what I'm going to hear all the way home. But, yes, thanks so much
Thank you
for
very
sharing
much.
this information with us. We appreciate that. And I know you'll accept email questions. If there's any that didn't get answered here tonight, feel free to email. Take some of the information with you. And on behalf of the group, just a small token of our appreciation.
Thank you. It's very nice. Thank
Yeah.
you very much.
Thank you.
It was